As you know, the World Health Organization made some kind of confusing comments the other day that they tried to clarify about whether you're asymptomatic if you're able to spread the coronavirus. So joining us live here this morning to help clear up some of the confusion is Philadelphia Health Commissioner Dr. Thomas Farley. Dr. Farley, thanks so much for joining us here today.
Good morning.
So can you kind of walk us back through what is the actual case with all of this? If you are asymptomatic, can you spread the virus?
Absolutely, yes, you can. The most common situation is somebody spreading the virus just before they develop symptoms, in the 24 or maybe 48 hours before they develop that cough and difficulty breathing. They might be able to spread the virus. And so we certainly want people who have symptoms to stay away from other folks and wear a mask so they don't spread it. We also want everybody to be wearing a mask when they're around other folks, because you never know whether you might be in that period just before you're developing symptoms. So this is something we're all going to have to get used to wearing.
And you mentioned pre-symptomatic versus asymptomatic. Can you clear that up for us too?
In the 24, 48 hours before you develop symptoms, you definitely have virus in your system, and you can spread that. There's also a question about the fact that some people get this infection and they never show any symptoms. And so we don't know for sure whether people who have no symptoms at all can spread the virus at all. I would certainly think it's possible, and so that's why we need to be so cautious. And just an example, so people understand, we had early on here a woman who visited her daughter in another city, and then her daughter was fine, she was fine. She came back. The day after she came back, her daughter developed symptoms, and then 3 or 4 days later, the mother developed symptoms. So we know she must have acquired the infection during the time she was visiting and before her daughter developed symptoms. So the key message is everybody needs to assume that they might be able to spread it and needs to be wearing a mask.
Yes, masks are so important. We've been learning so much about this virus in the last few months. Can you tell us, is there still a lot that you guys as medical professionals are still trying to figure out as we navigate all of this?
Well, we don't know how many of the infections that are acquired out there are from people who don't show symptoms. And how long before they develop symptoms they might start to spread the infection. And so, we are doing more testing, we're doing contact tracing. That really works for people who have symptoms, but we don't know how much of our overall strategy that represents. The other piece of our strategy is the mask wearing. So we now need to have that combination in order to do this. And we don't know how much each contributes to that, but we're going to have to do both until we have a vaccine.
All right. And as we see the region start to slowly reopen, what do you want people to keep in mind as they start, heading back to work, heading outside? And I think people are starting to feel a little bit more comfortable being outdoors now.
Well, what this means is it's not return to normal as we were before the epidemic came here. The virus is still here. The virus can still cause a big epidemic surge. So 3 things: mask, distance, wash hands. With the thing that people probably are most likely to forget is the masking. So we will be requiring people to wear a mask when they're, say, going into a store or in any other place indoors around other people. And we're recommending that people, once you're doing that, just do it everywhere, all the time. If everybody does that, then we protect everybody and we can really get our economy going without the virus resurging.
Yeah, those masks are so important. And, a lot of people, as we've been seeing these last couple of weeks, have been outside protesting. Are you concerned that, not everybody was wearing masks, that could lead to an uptick in cases being diagnosed?
We are concerned about that. It's hard to say. Partly it's my job to worry about that. We are first recommending that people who participate in those protests stay away from other people for 14 days so that if they get the infection, they don't spread it. Second, we recommend that they be tested after 7 days. And then we're going to follow our numbers. So far, it's been about 10 days since the protest started. We haven't seen any sign of increased transmission. Fingers crossed, we'll see what happens over the next week or so.
All right, let's hope it stays that way. Dr. Thomas Farley, the takeaway here, keep wearing those masks. It keeps you safe and those around you safe as well. All right, Dr. Farley, thanks so much. We appreciate your time.
Great, thanks for covering it.